With all the talk about vaccines for COVID-19 and the attention that's been given to the importance of maintaining the right temperature for these vaccines, we at URAC thought it would be a good idea to have a discussion on how we have addressed the critical area of cold chain and temperature management of medications within our pharmacy programs. My name is Heather Bonome, and I am the Director of Pharmacy with URAC. I have with me here today Jennifer Richards, who is a Product Development Principal at URAC. Jen is a PharmD and a JD and is a former URAC Pharmacy Reviewer. And in her current role, she is responsible for the development and writing of new standards. She also authored the most recent version of URAC's Mail Service Pharmacy and Specialty Pharmacy Standards, we refer to as version 4.0, which includes some new requirements around temperature management for medications. So who better to have this discussion with? Thank you very much for joining us today, Jen.
Thanks for having me.
Absolutely. Okay, so let's just jump in. I'm going to ask you some questions and we'll go from there. So to start out, why is temperature management of medication so important?
So the first thing to recognize is that medications that are not stored at appropriate temperature ranges may not work. There are many medications that are important for treating very unique disease states, and they do require a more controlled temperature environment through storage and through shipping. Patients don't really want to have to worry about the integrity of their medication when they get it, because it was stored or shipped in a temperature that was inappropriate. So really controlling that and working to make sure that you have proper temperature management procedures all the way from storage through shipping will help build a level of trust between the pharmacy and the patient.
Mm-hmm. Absolutely, makes perfect sense. So what URAC programs address appropriate temperature management of medications?
So all of our current pharmacy programs that touch medication storage and or delivery incorporate temperature management requirements. This is from community pharmacy to mail service and specialty pharmacy, all the way even to our infusion programs. We have the most experience working in specialty pharmacy and mail service pharmacy. That's where we see most of the shipped medications. And since COVID-19, we've actually seen even higher amounts of shipped medications within these programs. And when we're reviewing these applications, we're seeing that most of their medications are being shipped right now.
Right. Yeah, absolutely. Great. So what do the URAC standards address, or what are the requirements within the URAC standards?
So we go all the way from storage and handling. So this would be making sure that your refrigerators, your freezers, your room temperature, your humidity are all within appropriate ranges. This requires continuous monitoring so that you know exactly when and how your different storage areas may have gone out of range. And then we also touch upon shipping and distribution. I don't want to say touch upon, that's not completely accurate. We expand upon shipping and distribution quite a bit. So for every package size that you ship or a pharmacy ships, for every single medication type, temperature range type, so room temperature, cold temperature, refrigerated, and your frozen temperatures, all of them are required to be validated through testing within our current programs.
Got it. Makes sense. So how does URAC create these standard requirements, or who did URAC work with to help write the temperature management standards?
So super important to recognize that we at URAC do not write these standards in a bubble. We rely on our industry experts to help guide us and understand what's happening currently within the industries, specifically around temperature management. We spend a lot of time working with industry experts to understand what the requirements are for different from different organization types, and really helping to identify the standards that would best match and be appropriate for our pharmacy partners. So we started conversations with USP and supply chain engineers and the chair of the pharmaceutical cold chain interest group of the Parental Drug Association. So we've talked to a lot of really, really important people in temperature management. But not only did we rely on these experts, we also looked to our accredited pharmacies to understand what practices they were currently undertaking and where they wanted to go and what would expand and make their practices even better. We also had pharmacy organizations on our advisory group when we created these standards. This would be NASP, NCPA, and we worked with all of these partners to really help develop standards that raised the bar for temperature management.
Awesome, that's great. So can you talk a little bit about how the temperature management standards within these programs have evolved over time?
Yeah, so we started off super general. We were really just discussing stability and integrity within the pharmacy and during shipping. No direct standards on temperature ranges or management or anything like that. Just really working towards, was there stability and integrity of the medication. In version 3.0, which was released in 2015, we started to raise the bar a little bit there, and we put in specific validation requirements for cold chain medications during shipping. We still had temperature integrity within the pharmacy. We were asking for monitoring of fridges, freezers, humidity, and room temperature, but we really expanded into the cold chain shipping requirements. Then in 2019, we decided to take it to the next level with our 4.0 standards, and this is mail service 4.0 and specialty pharmacy 4.0. We expanded the validation requirements for shipping medications to require more frequent testing, and it applied to all temperature ranges. So all of your cold chain, but then also room temperature and freezer stored medications. The last thing is version 4 also focused a little bit further on internal storage temperature management. And we started to require continuous monitoring for all of those drug storage areas. So similar to what we are hearing about with vaccines, it's so key to make sure that all medications are even stored at the appropriate and proper temperature ranges to make sure that there is integrity behind those drugs and those products.
Absolutely. That makes perfect sense. And thank you so much, Jen, for sharing all this great information with us today. We really appreciate it. And thank you for joining us today to view this talk on URAC's experience with raising the bar with standards on temperature management medications. For any more information about URAC's accreditation standards in our programs, please visit our website. Thanks a lot.